Hello everyone, it's Holly here, and as promised, this is my video from hospital. I've got to stay in hospital for 2 weeks for intravenous antibiotics, and this basically means that I have a 2-week course of antibiotics, which is given through my veins. These antibiotics are stronger than sort of oral ones that you take, and therefore they are more effective and really give me a boost. I call it a bit of a MOT. Hospital admissions are one of the main things that you have to get used to and deal with when you have cystic fibrosis. I come in for 2 weeks, or 3 weeks, depending on how poorly I am, every 3 months. When I stay in hospital, I have my own room. This is because it minimises any risk of infection. I also have an ensuite too. So I'll give you a little peek of my room. So there I am sat on my bed at the minute. Go around this sort of chair and cabinet. Well, that's my IV pump there. Here we go. All the way around and back again. And up there's window. To have the intravenous antibiotics, they have to have access to my veins. As I've got older though, my veins have deteriorated in my sort of arms here and in my hand. This is just because they've been used so much, and the build-up of scar tissue means that when they put a new line in, they tend to break or sort of get infected or clot, and therefore have to get taken out. So last year I had something fitted called a portacath, and it's situated just here on my left side, sort of in line with my arm, and that gives them instant access to my veins, in which they can inject the antibiotics. This is what a portacath looks like. It has to be surgically inserted and can last up to 10 years. It consists of the portal, which holds the septum, a silicone bubble where the needle is inserted. The attached plastic tube is called a catheter. It runs from the portal into a vein which leads directly to my heart. Here is a photo of me before my operation to insert the portacath. The surgeon drew on me the 2 possible places for it to go, and as you can see from the next photo of my chest x-ray, I had it placed on my left-hand side. From this photo you can also see the catheter going into my heart. Here is all the equipment needed to access my portacath. It all comes pre-packed and sterile to prevent any risk of infection. I sit down to have my port accessed. My port is situated on my left side on my chest, about level with my armpit. You can see the scar here from when it was fitted. This will fade with time. I also have a second scar slightly higher up, which is where the surgeons inserted the interior tube of the port into my blood vessel. The first stage of accessing my port is isolating the area with a sterile toweling. The area of skin is then cleaned with this lollipop device, in which a sterile solution is let out to sponge as it is wiped across the skin's surface. This removes any germs or bacteria. My nurse then feels for my port under the skin so she knows where to aim the needle. The needle is then punched into my skin from a short distance. As the needle enters my port, my nurse will feel it hit the back of the septum, signalling it is in the right place. A syringe of sterile, salty water, known medically as saline, is then flushed through the tube. As long as the tube flushes and has no blockages, my nurse then pulls back on the syringe to draw blood to check the needle is in the right place. These first few ml of blood go into the syringe of saline. The syringe is then detached and discarded. A new, empty, sterile syringe is attached onto the end, and the necessary amount of blood required for tests is then taken. After that, a new syringe of saline is then used to flush the line again to get rid of the blood and clean it. Finally, an anti-clotting drug called heparin is put into the line to stop blood clotting in the end, blocking it or causing infection. You will have noticed that between each syringe, a white device on the tube called a clamp is being pushed. This is to keep the right pressure in the tube and stop air or bacteria getting in. Therefore, it is essential that when no syringe is attached to the end of the tube, the clamp is on. A dressing is then placed over the needle entry site to protect it from infection and keep it in place. The tube that hangs down I just tuck into my top and nobody can see it. My port stays like this with the needle accessed for the duration of my course of antibiotics. When my course of intravenous antibiotics is over, the needle can be taken out. To do this, they firstly remove the protective plaster and gauze so the nurse can access the needle. The nurse then holds onto the green butterfly base of the needle and gently pulls it out. This is painless, I just feel a slight tugging sensation. The area is then wiped with a sterile swab and I then put a plaster or gauze over it for a few hours until it is healed over. I have my IVs 3 times a day. It's 6 o'clock in the morning, 1 o'clock in the afternoon and 10 or 11 o'clock at night. They last about sort of 10 minutes in the morning and night, but at the lunchtime one it takes about an hour because I have one antibiotic that has to go in on a pump rather than being pushed by a syringe over half an hour, so it takes slightly longer. Other things when I'm in hospital that I have to do include having OBS, which is having my blood pressure done, monitoring my oxygen levels and taking my temperature, and they do that every 3 to 4 hours. I'm not going to lie, it gets kind of annoying. The physio comes and sees me every day, and I go to the gym and I go on the treadmill, the bike, we do sort of core stability exercises, and then we come back and do sort of breathing exercises to help like move the mucus, and it's another method of physiotherapy. The dietitian sort of pops in every now and then just to check that I'm eating okay and the food's alright, and then my doctor comes in sort of once or twice a week too, just to check my progress. On the last day of my admission I get discharged and sort of they just write up all my notes, make sure that I'm well enough to leave, and they give me all my sort of prescribed medicines to take home with me, and then that's it. They make me a clinic appointment for about 2 months' time. So yeah, that's sort of hospital for you. I hope you've enjoyed my video and you sort of learned something new. Thank you for watching, and like last time, I just want to sort of promote Cystic Fibrosis and the CF Trust. I will again put the link if you want to donate. Thank you for watching. Bye!